Hello friends and welcome to the channel. I'm Dr. Mohsen Raj. I was All India Rank 17 in AIMS PG 2017, All India Rank 11 in the PGI entrance in 2017, and I was All India Rank 1 in the DM entrances by NEET, SS, AIMS, and PGI, all the three. This video is a pure, useful, video full of tactics on how you solve the multiple choice questions. Because remember, everybody has prepared. Many good students have prepared equally well, but then who gets the top rank or who gets to the top 20 or top 30 ranks in the list so that you get a seat of your choice? It's the person who has this ability to solve MCQs well. Because what matters is to get the option right. I don't care what your baseline information is. I don't care what your skill set is. Doesn't matter. If you get the right option, you're the winner. You get more number of correct options, you're the winner, right? So I'll give you certain examples or the things that have helped me to go up to even rank 1, and that certainly will help you to improve your rank in your exam. So do watch the video till the end. If you haven't subscribed to the channel, subscribe to the channel. More such useful videos are on the way. Now, lesson number 1. Understand that there's always a mix of easy questions, medium level questions, and difficult questions. So, first lesson is when you open that exam window, you get some difficult questions right at the start. Don't get discouraged, because it's quite possible that you're right now facing a difficult block of questions, and after this, you'll face an easy block of questions. Because remember, the exam has to contain easy questions, exam has to contain difficult questions, and the order in which they give you these questions is totally random. So for example, when I attempt the paper, I might be given easy questions at the start, you might be given difficult questions at the start. So when you face your question paper, you're feeling difficulty in solving questions, have patience, wait for the average level questions, wait for the easy level questions as well. Don't worry, the paper is well balanced. Okay, now, the second thing that I want you to understand is that roughly, if you take a 200 question paper, a hypothetical paper with 200 questions that you have to solve in maybe 3 hours, 180 minutes. Okay, so roughly 120 questions would be average questions. Every student who has prepared well should get those 120 questions right. I mean, no, they're easy questions. They're almost like one-liners. They're almost like, simple repetition of facts from the books or review books or from your study notes. They're simple. They're easy. You can get them right. 60 questions are medium to hard level difficulty. 20 questions are very hard. This video, I will tell you how important these 60 questions are and what are the ways in which you can get even these hard questions right. Now, lesson number 2 that I want you to remember is that, see, if you get these 120 questions, if you get any one of these questions wrong, I don't think you're prepared well. I think you should go back and you should prepare the subject. You should prepare for the exam thoroughly again. So this is not about you. I'm talking of people who have prepared well. They know these questions are easy. They've done these questions easily. Now, what about the 60 medium or difficult level questions? Because they will decide your place in the merit list. Now, what about those 20 questions that are hard or that are very hard? Remember, they're hard for everyone. They're hard for rank number 1 as well. And no one has actually prepared for such questions. You cannot prepare for the 20 hardest questions in the test. And they'll be different in the next year paper, right? You cannot prepare for those questions. Number 3, very useful one. Use this button called review, marked for review, very wisely. Personally, I almost never used it unless it was absolutely necessary. And one more thing, read the instructions. For example, one exam might consider, like, if you've answered a question and marked it for review, that could be considered for evaluation. For example, NEET might consider that for evaluation. But if you appear in INICET or NEET or AIMS DM exam, this will not be considered for evaluation. So be sure, read the instructions, whether this answered and marked for review, is this considered for evaluation or is it not considered for evaluation? So to be on the safer side, don't keep too many questions marked for review, because imagine if you keep a lot of questions answered and marked for review, and then the exam window closes by the time and you've forgotten to just convert them to answered. questions, you are in a huge loss, right? I personally avoided it as much as possible unless there's a question I feel I can change my mind later on. I need to think more. There'll be rare few questions, maybe 2 or 3 questions that you can keep till the end. Now, lesson number 4 is you have to attempt more questions. If you're from unreserved category, you want a top rank, you want a top seat at AIMS or PGI, you need to attempt more questions. The rule I used to follow, see, if you attempt less than 180 questions, say you sit in the exam of 200 questions and you attempt 170 questions. For me, it was like you have eliminated yourself already. Before even the results, you've attempted too less number of questions, because even those 170 that you have attempted, there will be a good number of questions that you feel are right but are actually wrong from the examiner's point of view. So nobody can be sure in these competitive exams, especially conducted by AIMS and PGI, that this particular option is the correct option. There are very similar choices. Maybe the examiner thinks choice B is right, you thought it's choice A that is right. It's going to happen many times. Otherwise you feel it's correct would turn incorrect. So you have to play big. 190, more than 190 would be ideal, but again, this will depend on the level of the difficulty of that paper, right? If it's very difficult paper, maybe you might consider doing less, but on an average, more than 190. This used to be my target, and I followed it in my post graduation. I followed it in my DM exam. I used to attempt as many questions as possible. There'll be questions, when you're not sure about the answers, and there are ways to crack such questions. That is what I can focus on the next slides to come. Now, let's take a look at this question. Let's assume that I don't know the answer to this question. It's about a 29-year-old male who has episodic abdominal pain, has stress-induced edema of the lips, tongue, and occasionally larynx. He's likely to have low levels of which of the following proteins? Now, imagine I don't know about hereditary angioedema. Imagine I don't know about this condition. But I'm giving 4 options. Just imagine I don't know the answer. So you have to come up with some way to crack into a question that you're not sure, but you have to find a way to crack into the question. For example, I never heard of doing cyclooxygenase levels in any patient or being related to similar disorders. So I feel cyclooxygenase is not in the options. That's not the correct answer somehow. I also feel that somehow I remember it reading it's something to deal with complement system. So I believe choice A or choice B is the answer, but I'm not sure whether it's A or B. Then it is a good practice to mark one thing, randomly choose A or B, because you're already 50%, your 50% chances of being right, 50% chances of being wrong. I can choose any one of them. And by the way, the answer is A, of course, C1 esterase inhibitor. This is the deficiency of this inhibitor that causes hereditary angioedema. Now, lesson number 6 that I want you to remember is such questions that have a very long stem. If you read this fully, you will waste 40 seconds in reading it. Then you'll maybe possibly read it again because you have missed some bit of information. But a good logic here is to read the last line, the exact question. All of the following aspects of his history increase the likelihood of ACS, except. And read the option. So it actually boils down to the fact that, do you know which of these points does not fit a history of acute coronary syndrome? That's all. You don't have to read this entire 40-second stem of this question. And if you read it twice, you're going to spend more than a minute reading it. So I can easily figure out that a pain due to myocardial infarction or acute coronary syndrome is not positional. So we know it cannot be improved by lying to particular side. Rest, yes, people do feel sweaty, they have diaphoresis, they may have nausea, vomiting, it's a pressure-like sensation, it may radiate to either of the shoulders. That is correct. So I could answer this question even without reading the full question. So that is the trick in long stem questions. Read the last line and read the options before you read the stem, and read the stem only if you feel you should read it. Now, coming to image-based questions, a similar thing follows in the image-based questions as well. Once you take a look at the image, see, there are hundreds of things that will come to your mind on looking at this image, but look at the options first. What do you need to think? Is this chronic renal failure? Is this about some bile duct obstruction? Is this about heart failure? Is this about portal vein thrombosis? So immediately I can recollect that this seems a nutmeg liver, which is due to chronic passive congestion of liver in patients of heart failure. So even without reading the stem of the question, just the last line, Most likely, what does this patient have? He has heart failure. That's the right answer. So image-based questions, long stem questions, look at the options first, then try to answer the question. Now, imagine there's a question that you have absolutely no idea what the answer is. Still try to answer that question. Still try to find some way to just crack that question, because you have to solve more than 190 questions. So you have to find out ways. For example, this is about a 53-year-old man who has the skin lesion that is being enlarging over last 2 months. And this is the picture that they have given. Physical examination has no other remarkable findings. Now, which of the following occupations is the man most likely to have had earlier in his life? So, which occupation predisposes to this particular lesion? Well, I have no idea what this lesion is, for example. Then how do I figure out that which occupation did this patient have? But what I can, there are multiple ways to think about it. If you can just kind of pick the odd one out, which one would you choose as the odd one out? Well, probably, see, these are all indoor jobs, right? Auto repair mechanic, he'll be working in a garage. Chemist would be working in a factory. Oncologist would be working in a cancer center. But this miner would be working inside a coal mine. The exception would be a lifeguard on the beach. He's working on the beach. He's working in the sunlight. And I remember somehow that these skin conditions, which could possibly be melanoma, maybe at, person who is working on a beach, he is at higher risk of this disorder. So I can choose lifeguard on the beach. I'm not sure, but it's not wrong to choose such an option, because think of some common logic and try to answer the questions, because not everyone has every answer. Even All India Rank 1 will not be sure of every question, but he will still mark most of the questions. It's because he has learned these MCQ solving skills over time. Now remember, if there are multiple correct options, as in a PGI Chandigarh type of an exam paper, right? If there are multiple correct options, play it like a test cricket. Do not play it like a 2020 cricket the way I was telling you. Do not mark options unnecessarily, because that's going to hurt you. Mark an option only if you are 100% sure. So now, how can you develop these skills? Because I just said it once, but you have to practice it. See, appear in the grand tests, take timely tests, and practice these skills. In your home test, in your grand test, for example, you will come across a situation where you're not sure about an answer. Practice solving that question. Try to solve that question. Try to come up with an answer, and you will come to know about the strategy that works better for you. You will get a gut feeling, yes, this is how I will solve this question. So it's a matter of practice. Remember, the skill of MCQ solving, this is not something that comes from birth. This is not something that comes from person's IQ. This is something that comes after solving thousands and thousands of MCQ questions. So appear in as many tests as you can, and practice whatever I just told you. I would definitely appreciate if you subscribe to the channel, and more such useful contents are on the way on this channel. Thank you.